I always say every episode's a good episode. And it's really, really true. Every episode is my favorite. This guest today is Dr. Justin Houman, and he is a urologist. And we shared lots of conversations about men's health. And I think this is a really important conversation to have. Men who have symptoms of erectile dysfunction, premature ejaculation, sexual dysfunction, hormone, a drop in hormones. We talked about all of it. And we talked about the stigma because, there are stigmas attached to men going and getting their symptoms looked at by a doctor. So, Dr. Justin is fabulous in sharing how to get yourself to see a urologist. And his words were, if it's bothering you, get it looked at. And he also said something that I thought was really important. He said, it's a lot simpler than we make it. So, we have a problem and we make it very complex in our minds. Really, it's an easy fix. It's a quick fix. If you can get on it early, it might be easy. Now, for those of you men, this is for you today. This is not for women. I mean, of course, women can listen and know how to support, but this is about men's health. And this is a important conversation to reframe how men can ask for help, they can communicate, they can move through the stigma of masculinity. This is what we talked about. I said, there's some stigmas. So, how do we do this? There's a stigma masculinity, there's a stigma of fear of judgment, there's a stigma of this will impact my relationships, and there's also a stigma of um, shame that is associated with a sexual dysfunction. And so he has some incredible words, and I was so appreciative. So, this conversation, men, is for you. And I am so happy to share with you this episode of The Lori Clark Show with Dr. Justin Houman. Thank you for coming on the show today.
Thank you. Thank you so much for having me. I'm excited for this.
Oh, I know. This is, I have a lot of men in my life, and this is a thing that I feel is so important where, no matter how old and no matter how young, the theme that I keep hearing is, I don't want to deal with my health. So you are someone that I'm curious about learning from you, especially about your work in urology.
Yeah, so it's a good question, and it's something that I've come to somewhat appreciate over the last few years of my practice. But as urologists, we're a specialty field of medicine where we focus on usually men's issues, the urinary system, um, prostate health issues, and whatnot. I specialize in fertility and sexual health
Mm,
primarily. But one thing I've come to realize about the field is men, to your point, men really don't like to engage in their own health for a number of reasons: the taboos, the stigmas, the macho man personality or mentality. And what's for better or for worse, urologists were really the first touch point for a lot of men in the healthcare system because a guy doesn't know when he has high blood pressure, diabetes, high cholesterol levels. But I'll tell you what, when he's experiencing erectile dysfunction, he knows it and he's going to come see us. When he's waking up at night 5, 6, 7 times a night and he's very bothered, he's going to come see us. So although we're a specialty field of medicine, a subspecialty field, we're usually the first touch point for a lot of men. So we play an integral role in engaging men in their own health.
hmm, hmm. Well, that's a touchy subject for most because, if it affects like their elbow or their knee, that's different. But when you're talking about their sexual organ, this is a big deal. And the whole world is collapsing.
Yeah, it's a huge deal. It's huge, and I get it. Of course,
Yeah,
I understand the importance of it.
of course, of course. So So what have you been working on? Like when you are dealing with sexual health, what does that look like?
So it's, there's a lot of, the good thing is that men's health is coming to the forefront for a lot of men, younger men. There's a lot more consumer options for men to engage in their own health. Um, one of the things, one of the gaps that I've noticed, at least from a medical standpoint, is there's a lot of services out there now that are essentially giving a band-aid or providing a band-aid for men if they're experiencing sexual dysfunction, just giving
Mm,
out Viagra's and Cialises. And by no means am I saying those are bad, right?
mm,
There's obviously a role for Viagra and Cialis, but for me, the more important thing is, and what I pride myself on working on is ideally diagnosing the issue rather than just saying, "Hey, here's a treatment, go figure it out. You'll be 30, as a 30-year-old, just take Viagra and Cialis for the foreseeable future." You want to
right.
get to my goal is to get to the root cause of it, whether it's a hormonal issue, a lifestyle issue, a psychogenic issue. Sometimes there are anatomical issues that could be corrected, but the majority of the time, there's an identifiable medical, physiological cause that we can fix. So these men aren't experienced or aren't medication reliant for many, many years.
So you're saying that, okay, fine, you can take Viagra if you'd like. That's not going to stop the problem and the reason why things aren't going the way they used to in your life.
Yeah, there's more to it than just giving. Viagra plays an integral. These medications, Viagra's and Cialises, they play an integral role for sure. But they don't. They're treatments. There's usually a diagnosis that we could
Hmm.
identify and correct, rather than just giving a pill to say, "Hey, here you go along your way."
Okay,
There's
so
a long-term solution to it rather than just giving medications.
right, right. And so then what's the first step? So some these men are listening today and they're like, okay, I'm intrigued. Okay. So now
Yeah.
they're going, I have some things that I'm noticing. So, what about sexual dysfunction will they start noticing? And what would you like men to do to help them have a better experience?
I mean, first of all, and if the first time you experience any symptom, the earlier you address it, the earlier you talk to a doctor about it, whether it's your primary care doctor, a urologist, a men's health urologist, what have you, the earlier you address it, the better. Because the more you kick the can down the road, it's going to become a bigger issue, a more chronic issue, a more difficult to treat issue. So the earlier you address it, the better. And there's no right time, but all I would say is if it bothers you, then it's worth investigating, right? There's no hard and fact rule of if you're doing it, if it's bothering you. I mean, if you've experienced it for 1 month, but not 3 months, maybe you should wait for 3 months. If it's bothering you, talk to a doctor about it. Because again, it makes it easier for us to address and to treat.
What kind of tests do you do? Just blood work or
So there's a couple things. One of them is definitely blood work.
okay,
We want to look at any markers of chronic disease, blood pressure, elevated blood pressure, which is not, that's a test, but
yeah,
cholesterol levels, which is a blood test. We do di we check their blood sugar levels to make sure there's no signs of diabetes, and then the hormones. Obviously, testosterone plays a massive role in sexual function, erectile function, libido. We look at your estrogen markers. We look at various hormone levels just to make sure, because those play an integral role. And then there's also a physical exam component just to make sure everything anatomically looks okay, because that could definitely play a role in negatively impacting sexual health.
is there more often do you find a low testosterone or what role does estrogen play as well?
So it's definitely testosterone is the integral one.
Okay.
There's times where men who, like, for some men who are on testosterone supplementation,
Yeah.
testosterone replacement therapies,
Yeah.
their estrogen levels. uh, all men need estrogen. So sometimes
Yeah.
when you take too much testosterone, your estrogen levels rise, and that throws off the hormonal balance. So there's some fine tuning in that scenario.
Yep.
But generally speaking, when it comes to the hormones, it's low testosterone that we have to correct.
And that doesn't happen because of, is there external forces that reduce testosterone?
Definitely, definitely. I would say, I mean, one of the big things that we're noticing these days is a lot of younger men are coming in with low testosterone. For
Okay.
me, I think probably two main reasons.
Sure.
Number one, the modern lifestyle where we wake up, on our phones, go to work, we're on a computer in front of a computer screen, we come home, we're watching TV, Netflix. Everything is our life is a lot more sedentary. Less activity, less vitamin D, more processed foods. As a result of that, the generally having lower testosterone for men, but also men of my generation and the generation behind mine are much more proactive about their own health. So they're checking their testosterone levels
Yeah.
um, more commonly or more often than previous generations. So we're just seeing a larger number of low T men.
Yeah.
And those are probably the two main external factors.
Hmm. How do you measure that?
It's a simple blood test, really.
Okay.
And ideally we check it before 10 a.m. Your peak
Oh,
testosterone levels are in the morning. So if you want to get a good value for your testosterone levels, check it before 10 a.m.
before 10 a.m. And that just would be through, so that's blood, and there's no urine test to do that, just blood test.
Just a blood test. You go to your doctor, you just do a blood test, very simple. We have the answer within a day or two, and we're able
Yeah.
to appropriately treat it.
What happens with, so I know also there's men that are suffering from ejaculation problems. So it's too fast, too slow, it's not working properly. How do you work through that? How do you help that?
So that one requires a little bit more.
Yeah.
Hormones play a role for sure. There's there's also the psychological aspect to it, and then there's more of a neurotransmitter aspect to it. So the way we treat, let's say like premature ejaculation, for example,
Yeah.
too fast,
Yeah.
is is actually pretty interesting. What we do is, I don't know how familiar you are with antidepressants, but one of the side effects of antidepressants is sexual dysfunction. We call it delayed orgasm. So
Okay.
instead of giving a therapeutic dose of a SSRI, like a Lexapro, for example, we give a subtherapeutic dose where it doesn't impact it here, but you get the side effects of it. So guys who have premature ejaculation, we give them like a subtherapeutic dose of Lexapro, for example. Paxil is the one
Yeah.
we typically use.
Yeah.
And that gives them the side effect of delay. It delays their ejaculation without any of the mental or cognitive um, effects.
So I find that interesting. Maybe tell me more about that, because so a an antidepressant will suppress, um I would say, excitement, I would say joy, I would say happiness. Is that true?
Um, yeah, I guess a therapeutic dosage it can in some men.
Yeah.
Are you referring to sexual excitement or just in
I
general?
I'm well, I'm referring to sexual excitement.
Yeah, the excitement is still there. It's just
Yeah.
it delays it makes ejaculation harder. So it raises the
Right.
threshold for ejaculation. And that's all because of really it plays on the serotonin, dopamine, neurotransmitters in your brain. That's the part that's playing on. And that's one of the side effects. So if a guy has normal ejaculation and he gets on
Yeah.
a SSRI,
Yeah.
I can't tell you how many times in a given month guys come in, they're like, what can I do? Like, how do I? Because obviously I feel good, right? I'm not
Yeah.
depressed, I'm not
Yeah.
anxious, but
Yeah.
I just can't ejaculate. What can I
Yeah.
do? So that's, we have to play around and obviously find different modalities to preserve the mental benefits while also enhancing and optimizing the sexual benefit.
Well, and there's extenuating circumstances. Like if you've got let's say you have a headache, or you have some, you're not kind of, your head is not there in some ways, right? Then that can play a role, or those kinds of things. But we're talking about, you know, so maybe even anxiety, or you get in your brain and you're rolling around this narrative of, oh, this is going to be crazy, I don't know what to do, panicking. That can really short circuit a lot of different things.
Definitely,
Yeah.
definitely. Oh yeah.
Yeah. Are there myths about this?
Which part?
Well, just the dysfunction in general. I don't know. I mean, you can tell me more than I can.
Yeah, I would say I would say like in terms of sexual dysfunction as a whole, there's a couple myths.
Yeah.
The idea um, that you always have good erections for the rest of your life, that's a myth, right? But we're all going to get erectile dysfunction at some point. It's all about trying to do as much as you can to make that a gradual decline versus a rapid decline.
Yeah.
Um, that's a common myth. A lot of guys come in, they're like, "Oh, I should be able to have super strong erections for the rest of my life," and
Yeah,
that's not what it is.
yeah.
We're gonna age, right? Like your
Yeah,
sexual health is like anything else.
I
You're gonna
know.
age, but there's ways in which you could make those quality years um, better, longer, more enjoyable.
Right. See, as a woman, I'm in menopause right now. I'm like, wow, I'm gonna be 50 and I'm thinking this is this is really interesting, you know? And so I having men in my life, I say, guys, you know, it's not just me that has things. It's not just me that has, my sleep is impacted. My stress levels impact my sexual functioning, my life, being older. Like this is just life. And yet there's something about this that's embarrassing. There's something about this that is at its core. It just strikes fear into you. In your experience, do you know why that is?
Um, yeah, I mean, because well, for one, I think menopause has been it's much more. There's a lot more talk about it, and
Yeah.
before and after, how you feel before, how you're going to feel after. There's a lot more hype associated with it, a lot more education, a lot more. For men, there's andropause, which is something that's probably become much more common over the
Yeah.
last decade, at least conversations about it.
Yeah.
Um, but again, men don't engage in these conversations. Men just, oh, it's all right. Like, I'm feeling okay, and they don't want to engage. And women, and this is the beauty of women's health, like, and why women are so much better adapted in society, and
Yeah.
less depression, all that,
Yeah.
all these different mental health metrics. But because you guys communicate things way better than men, and men can really take a page out of that book, because that's truly the that could help significantly. At least talking about these taboo or stigma type subjects could really help men not only just feel like they've unburdened themselves, but more
Hmm.
importantly, um, open them up to discussions with providers who could help them out with these issues.
The word unburden is really important. And, in your work, how do you, somebody comes in, they know they need to see you. They're identifying, okay, I gotta go and see. I gotta see you. So when they do that and you pick up on this, how do you walk someone through this scary? It's scary.
Yeah,
And I think
yeah,
men aren't, I don't want to just say that so broadly. Maybe some men do not like to feel the fear or that lack of control that is apparent in what they're experiencing.
yeah. So you hit the nail right on the head. I mean, that's the bulk of it, right? It's just for them to come into the office, and for the first 5 minutes, just for them to feel like they feel heard.
Yeah.
Um, Obviously, at this point, I know I have a good sense of, you could read somebody pretty well, and I like to think that I'm pretty good at that part of it, where really just making them feel more comfortable about the topic, and
Yeah.
letting them know, look, first of all, you're not the first person today who's come in about this issue, and I promise you, you won't be the last.
Right.
And not to trivialize what they're going through, but a lot of young guys, it doesn't matter what age, but a lot of men are going through what you're experiencing. And for a guy to hear that, like, all right, well, look, like that in itself, they express what they feel. They realize that they're not alone, and just that unburdening, and realizing they're not the only one. That's a huge relief, because what happens is there's obviously medical stuff that um, impacts them, but it's more the mental, the anxiety, really the anxiety is a big part of it. Some of them go into depression as a result of it, but the anxiety and the mental buildup of all of this just makes it so much worse.
Well, I was thinking about this because what you're saying is the mental buildup and the anxiety is one of the things that make it so much worse. And one of the points I wrote down was, you know, um, I've heard it said, well, why don't you just be a man, right?
Yeah,
What,
yeah,
and what is a man, or toughen up, or like all these words that we use to stereotype, men don't cry, men aren't, all these things. And we use words and ways to kind of suppress the articulation of what needs to be said. I need to share. I want to emote. We sort of suppress that at a young age. Now, you know, I being a mother, I have four three adult kids and one teenager. And I've really encouraged them to share and speak their feelings, especially my sons. And so for me, it's very important that we share and communicate. But it's not always that way, and there's a lot of labels that are slapped on. And so what you're saying is, look, your health is your health, and it's really at the end of the day all we have, right? It's like enjoyment of life and
Yes.
living a life that is worth your moment, the present moment. Let's So I look at this and think, well, it has to start somewhere. And so this is why this is such an important conversation, because, you know, there's treatments, there's processes, there's ways to connect men, but the first step is what? What's the first step? Honoring your body, saying that you need it. Don't tell your wife or your partner, just go. And then
Yeah.
maybe share later. Like, because it's so difficult. I don't get it.
I think well, the good thing is younger men. It's hard to. I think it's well, yeah, I think it's hard as older men. It's hard to
Yeah.
teach these skills or these being
Yes.
emotive. But
Yeah.
younger men, I agree with you. I think that younger generation is very much more in line with this mentality, which ultimately is beautiful for mental health. And if it's good for your mental health, it's good for your overall health. So, yeah, and I really do think the tide is shifting in that direction. Hopefully quite drastically.
Well, I hope so too, because like you say, we maybe this generation and my generation haven't been really good at it, but it wasn't modeled to my partner, and wasn't modeled to his father, and it wasn't modeled, it's not modeled. And so we are trying to, like you say, change the tide and begin to start opening up a little bit. And I think we're doing a better job at it. Now, what are some challenges? What do you see here? Some challenges that we need to look out for.
If primarily for men.
Yeah,
Um, yeah, I would say, kind of piggybacking on this last, on what you just said,
yeah,
it's not letting, I think a lot of young guys, I could just tell you anecdotally,
yeah,
there's a, if there's this sense of whatever's affecting them physically,
yeah,
they start to get it built up in their own in their own head, and it becomes like this like I said, like an anxious mental health type issue. And I feel like a lot of times, especially for young men, I'm a urologist, but I feel like I'm a therapist to these guys, trying to tell them, like, normalizing the conversation. Listen, you're not
interesting.
the only one. It's okay. It's gonna be fine. And I really think that there's this there's this sense of everything has to be perfect. Like, I've watched videos about this guy, this macho guy, this influencer, this weightlifter, whatever it is, having this
Mm,
perfect life, doing all these things about his, his macho man, his sexual health is fantastic, high testosterone levels, all these different things. And people, young guys think they have to live up to that. And if they're not, it gets into their head. And we could address physical health issues, medical issues, but when it comes to the mental health stuff, it becomes a lot harder to manage and to treat once you build it up that much. So I think that's the challenge, at least for us, at least for myself, I could tell you,
yeah.
that's something that I do see quite commonly. And I'm a urologist. I feel like as much as I try to help them as a friend, it's quite difficult.
Wow. Wow. See, because it's a very complex, wouldn't you say?
Incredibly complex, incredibly complex. There's so many layers to this.
Yeah.
Oh yeah,
Yeah.
so many layers, so many
And
layers.
so what you're saying is you're the doctor, but you're also playing therapist in some ways.
Yeah,
You're
yeah,
dealing
absolutely.
with this other thing. And a lot of times we're not dealing with our context. We're not dealing with our trauma. When we grew up, maybe that's something that's happening. You've got all these layers and all these levels. It's very difficult to point people, in the right direction, I think, at certain times.
It is, and what's happening is I think it's more of a it's something that we have to think about the whole healthcare system, the healthcare system as a whole, where young men, where are they getting their information from social media? And although there's physicians like myself who go on social media and we have our our platforms, small platforms, but
Yeah.
a lot of these guys are getting information. it's maybe the right it's tough to say whether it's the right message or the wrong message, and a lot of times it's the wrong messenger, right? It's
Mm.
who it's just an average, I mean, just an influencer who's giving medical advice to a lot of guys. And is it right sometimes? Absolutely it is, but a lot of times it's not. And because they have a loud voice, at least on these social media platforms, it becomes much louder, and there's a lot of misinformation as a result of it, wrong expectations, and it becomes this whole thing.
You have a unique perspective because you're saying you're dealing with young men, but you're also dealing with elderly men.
Hmm.
You are dealing with, incontinence. And I'm not saying that a young man isn't coming to you with that. I'm saying that it's more typical when you're over
Yeah,
60, isn't it?
yeah, definitely.
And so then you have this really interesting perspective that it must be very challenging for you as a doctor. How are doctors faring in this situation?
Well, look, I think that's one of the beauties of the job too, right?
Yeah.
You see
Yeah.
people from as young as in their 20s to, I had a guy who was 101, yes, last week. And it's
101.
yeah, it's beautiful, right? You really could interact with people from, and that's the beauty of being a doctor in many ways.
Yeah.
But yeah, with that comes the challenge of, you want to be able to relate with different men of different age groups and yeah, try to connect with them. And um, this as doctors, this is one of those things, I think either you're born with it or you're not. You can't really
Mm.
teach that skill of being able to connect with people. Um, but if you have it, it's great. Patients will love you. But yeah, that comes with the inherent challenge. And also, you want to do it in a efficient way. So yeah, but listen, that's just part of the job. And luckily, I enjoy that part of it. It makes it quite fun.
Yeah, yeah, I can imagine. And so, as we sort of wrap up, I want to ask about there's four stigmas that I wrote down. So there's a stigma of masculinity that is something. Can you speak to the societal norms? Yeah, I think you've already done that quite well, but there's something about when men are ashamed about what they are experiencing, and you're talking about all these different things from premature ejaculation to incontinence to sexual dysfunction, and the shame or the ashamed feeling that can happen. So there's this stigma of masculinity that wraps itself around that.
Yeah, yeah. I mean, and listen, I'm not, look, I believe I get the stigma, right? I'm a young guy. I mean, I'm a guy. I get it. The stigma
Yeah.
associated with it when it comes to if you have any mental health issue, sexual health issue, I get all that. But it's completely wrong, right? Because the only re again, the earlier you address these issues, the better off you will be. The better off you will be from a from a relationship with yourself, yeah, mental health standpoint, relationship with your partner, all these things. Because the longer you kick the can down the road, the harder it becomes to treat.
That's
But
right.
I get it. I 200% get it because I'm the same. I get
Yes.
that stigma.
Yeah. I've had to work through that stigma. I'm not a man, but I'm a woman. And I've had
Yeah.
to work through that stigma of I have a problem. I need to get help because lots of women just drive themselves to exhaustion. The other stigma I wrote down was fear of judgment, because that's a big one. You're fearful of being judged. If you don't sit around and talk about it, then
Yeah.
you don't know that your uncle's dealing with it. You don't know that your brother or your father or your friend. And so there's this fear of being judged for what is you're experiencing.
Yeah, and it's the power of vulnerability, right? Being able to open up, that could just help you in so many ways, right?
Yeah.
Not just from a sexual health standpoint, but just really from a mental health standpoint. And again, it can make your relationships with your friends, with your partners, with your loved ones so much better, right? It just really escalates it. And is there a perfect rule of doing it? No, but just do it, right? Do it and keep doing it, right? Start small and just each day do a little bit more of it. And yeah, that's one of those ones that, again, I think to your point, a lot of younger guys, that younger generation is much, much better at it. Much better.
Well, they're much better because there's a bit of a distance between, like, you and I. We're not in the same room.
Hmm.
We can
Yeah.
talk, I can talk to you in a free way. You can talk to me freely. And so we're not up close and personal. And that makes you feel like you could, if I don't ever have to talk to you again. kind of thing versus, a family member. What if they say something or whatever? And so the other thing I think that is another stigma is the impact on relationships that, you know, how do you, if there's someone that has a partner and they don't know how to tell their partner, or they feel like they're going to be judged, what is the advice there? Because this is a big deal.
Yeah, yeah. Let me just say, if I could say, like, majority of the time when patients come to me, like for these types of issues, they're there with a partner, right? If anything, the partner's the one that made the call. The partner's the one, like, and
Did
I
you
can't.
say the partner's the one that makes the
Yeah,
call?
the partner's the one that he was like, "Hey, if you're going through this, let's get it fixed. Like, let's address this. Let me help you out." It's and I can't tell you with certainty, right? I really can't tell you with 100% certainty, but it's yeah, the broad majority of the time, it's not only met with it's only not that opening up about it is not only met with um like acceptance, but it's like a willing, a helping hand to go, what can I do to help? Like, is there anything I could do to make you feel better about this thing? It's a lot easier. I think that, like we all hype things up way more than we should. These things
Right.
are a lot easier than we think they are. But
Yeah.
I'm no angel here. I get it. I get it.
Me either.
Yeah.
Me either. My stubborn mode kicks in
Yeah,
quite
for sure.
frequently. But if Dave came to me and said, "Babe, I need to go to the doctor," I'd get the I'd be gone. I'd be getting the keys, starting the car, going, "Let's." This
Yeah.
is like a first.
Yeah. Yeah. Yeah, there you go. See, to your point, there you go. Like you'd be more than willing to, right? Like, of
Well,
course.
and I think, and and speaking to this part, we jokingly, when I look at some people in my life, I'm like, well, they just have longevity. Like some people can just go and they just don't ever stop. Doesn't matter what kind of stress in their life, they just push through every every obstacle because their drive is so strong. What do you say to that person who's doing this? It's equivalent to exhausting yourself in the worst way because it's about your health, and yet that's secondary.
Yeah. Listen, it's quite admirable, right?
Yeah,
And to what extent are they running themselves into the ground? I don't know.
yeah,
My sense is, look, there's a lot of those people who will thrive and mind over matter and they'll do just great.
yeah,
But my sense is like, look, if you Mother Nature always wins, right? So if you do that, like if you have the mentality of just go, 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 and
yeah.
um, everything will be fine and kind of burn yourself to exhaustion. Inevitably, most people are just going to end up running into the ground.
Hmm.
Um, but yeah,
So what, in wrapping up, what do you want to say? What's the encouragement here? We gotta, if we can hit on some things just to strike at the chord of what what can we do to optimize our reproductive health, our mental state, and our life around that.
yeah. Honestly, just keep it simple, right? There's no really. What's good for your overall health, what's good for your heart health, it's also going to be good for your sexual health, for your mental health, for your reproductive health. And I always tell guys it's four things. It's eat right, well-balanced diet, complex carbohydrates, lean
Mhm.
proteins, healthy fat,
Yeah.
exercise. Try to get at least 3 days of weightlifting in, 2 days of cardio. Try to get at least 7 hours of sleep every night, and then reduce your stress. Those four things. 'Cause
Mm.
look, I'll tell you. I have, and I'm very much into this whole biohacking thing as well myself.
Yeah.
Um, but I have patients who are, like I said, a 101-year-old guy. You think this guy was doing all these different supplements? Absolutely not. But what he
No.
was, if you don't have those foundational principles, all the other supplements that you're doing, it's not going to stick, right? You have to have the mashed potatoes before you have the gravy. All the supplements are gravy. Those four things are the most important things. If you don't have those, all these other things are going to go by the wayside.
Absolutely. I would agree with you. Like that's balance. Work life
Yeah,
balance is what you're talking about, really.
yeah, that's a huge part of it. And it gets harder and harder as we get older. we want more, and we want more. And again, I'm no, I get it.
Yep.
I'm the same way.
Yep.
But I try to be as mindful as I can about those four things throughout the course of every day and every week, and just being mindful of it helps move that needle just a little bit each day.
Yeah, yeah, yeah. Well, I really appreciated you coming on today and talking with me.
Thank you, thank you. This is great. I appreciate it as
This
well.
is so great. I always like to have conversations with men about men because I feel that, as a woman, I know all my stuff, but men, I'm so curious about why they do what they do. And, it's just remarkable I I feel the example that I've had in my life is men are really strong. They're the anchor. They're like, they gotta, be tough. And what you're saying is, sure, great, but not at the expense of who you are, of your health and or your mental health.
Right. Yeah. Yeah. It's a lot. Look, these things are a lot easier than we make them out to be, but we make them as men, we make them just so complicated. And we do. We do.
Yeah. Yeah. And they can just talk about it. So find someone and talk about it.
Amen.
That's
Well
that's
said. Well said.
Yeah. Yeah. Well, thank you so much. I appreciate it. I know you've got lots to do today, but thank you so much.
I appreciate this. Thank you so much.
You're welcome. Talk to you soon.
Talk soon.